Hi, I'm Jason Howland, and welcome to Speaking of Health, a place to help you learn how to live a longer and healthier life. You know, back pain is one of the most common health complaints in America. In fact, 9 out of 10 adults will experience back pain at some point in their lives. Here to tell us more about how to treat back pain without surgery is Dr. John Jakovich. He is a Mayo Clinic Health System physical medicine and rehabilitation specialist. Dr. Jakovich, thanks for joining us today on Speaking of Health.
Well, thanks for having me here on the show today, Jason.
We're talking today about non-operative spinal care. Just in broad terms, can you kind of explain what exactly that means?
Well, non-operative spine care, that's a good question. Most spine care for back pain and or other issues of weakness and so on generally doesn't need operation or surgery per se. The vast majority of back conditions, neck conditions, and so on really can be treated conservatively and non-operatively. I would say probably about 95% of these types of situations really do not require a surgery per se.
Do you think that there's a misconception out there that when someone has some severe back pain that automatically they think, I'm going to have back surgery? But that's, like you're saying, it's not necessarily the case, and not often.
Majority of back pain and neck pain issues, including radiating symptoms down in arms and legs, typically over time things resolve and improve. And surgery is generally not indication unless a person really has, say, weakness or issues along those lines, or very severe pain in some cases. But you're absolutely right.
Let's start with the basics of the spine and what exactly is the makeup of the spine and what it does.
The makeup of the spine, well, typically in a human being we have 7 cervical vertebrae, and in the thoracic spine, which is your middle spine area, that's 12 vertebrae, and then in the lumbar spine, which is the lower part of your spine, that is typically about 5 vertebrae. The spine is made up of ligaments, ligament structures, facet joints, discs in between the vertebrae, muscles to give stability, and as well as myofascial planes and areas that can actually stabilize the spine as well.
Now, you mentioned facet joints. We're going to talk about those a little bit later, but can you explain what is a facet joint?
Well, facet joint is basically, they're small little joints that run in your spine from your neck all the way down to your sacrum. They're in the posterior aspect, or the behind area, where they have small little facets. They articulate with each of the vertebrae and give you motion.
And I'm assuming the spine, it not only obviously holds your body up and gives you posture, but it also protects your spinal canal too, which is very important.
Absolutely. That's kind of really a mainstay of our spine. It really protects one of the most important neurological elements below your head, of course, in your brain, the spinal cord and the nerves that go through the spinal canal there.
All right, I'm going to ask you a very vague question. Mm-hmm. What causes back pain?
Well, that is a very vague question, and I'll give you maybe more specific answer on that. But
Great.
Back pain, it can really come from a whole host of issues, stemming from poor posture, poor body mechanics. I believe those are really like a very large portion of people that have especially low back pain, neck pain, that's not radiating to their arms or legs. Muscular stability is really a key component for a good spine, and stabilizing your spine with the muscles is really the key component. So a lot of this issue is maybe, like I say, poor posture, stability along those lines is a really good place to start with why patients are having pain. Other reasons are ligamentous strains, muscle strains from injuries, improper lifting, so on, repetitive motions type of deals that just accumulates over time. Other reasons for pain are degeneration of the spine, such as discs, intervertebral disc, where as we age, it's a normal progression where you have degeneration of the discs in between your vertebrae. But sometimes these kind of break down and give you a little bit more pain and irritation than you would normally have, such as a disc degeneration. You can end up with a disc protrusion, or something we call a sequestration, which is pushing of the disc material back into where the spinal column, spinal cord region is, and maybe pinching off on some of the nerves as they exit the spine and giving you pain that could be radiating down into your legs or your arms. We call it like a radiculopathy, or some people call it like a pinched nerve in layman's terms. Also, just degeneration of your spine from a bone standpoint within the facet joints. You can get what we call an arthropathy, a facet arthropathy, or degeneration in that area where it can give you actually localized pain in your neck and in your back.
So what you were talking about, is that the same thing as like a bulging disc, or I've got a herniated disc, those kind of things? Is that all similar to what you're talking about?
A bulging disc is really just a small area behind where the vertebrae is and the disc juncture, where you have a little bit of a small bulge, basically, as in the term. Oftentimes, people don't really have any pain from this. This can be really considered like a normal process of aging and so on. Often, most of the times, they're very non-symptomatic. When you get into the protrusion, where the disc material is pushed out a little bit more and maybe impinging onto a small nerve, such as coming out of your spine or your neck or your back, and then maybe giving you radiating pain down your arm or your leg, that may be obviously more symptomatic, and then often we can treat those a little bit easier.
So I would assume in all or most of these cases that pain is a pretty common symptom, but there are different forms of pain, correct?
Well, yeah, absolutely. I mean, you can have what we call, as far as low back or neck pain, you can have what we call myofascial pain, which is really the fascial layers between the muscles, and people can actually have disturbances in these fascial planes that can actually give you significant pain, even to the point of radiating symptoms down into your arms, where you might think it's coming from your neck and it's really absolutely not. So that's one type of a pain. The other would be like more of a neurological type of a pain. And that would be, say, if you did have a disc protrusion or a pinched nerve in your neck or your back, where the nerve is getting irritated and maybe cause you shooting pains down your arms or your leg, often in specific type we call dermatomal patterns, are very common. And that can be like a stabbing type or an electrical type of a sensation. And patients really tell you it's a very distinct type of a feeling. Other types of pain are just an achy type stabbing, what we call a little muscular type of a pain that people can experience.
And besides pain, what are some of the other symptoms? Sometimes I'll hear someone that has back problems can actually make like their leg go numb or something like that.
Absolutely. We are wired that way for sure. Typically, if you were saying having a radiculopathy, where you see like a pinched nerve, these specific nerves in your neck and in your back, they correspond to certain muscles in your extremities, so on. So you actually could develop weakness in a certain muscle, which would, if you develop weakness in your hand, or if you have a foot drop and things, that may be an indication of something a little bit more serious. So weakness is never a good thing, and that may be indication for potential surgery option. Not always, but you might be geared towards that. Now, numbness and tingling type sensations down an extremity could also be related to, say, a nerve type of a situation coming from a neck or the lumbar spine. That would definitely correlate. So you can get some odd types of sensations in your arms and your legs originating from your spine. Absolutely.
So what are some non-operative ways to care for the spine and treat back pain? What's the number one thing that you tell patients that are going through back pain? What's the number one thing that they need to do?
Well, the number one thing for anybody in this type of situation, especially if this is your first time, or even multiple times where you get flares of back pain or neck pain or radicular symptoms and so on, it happens in a great number of us. And it's a very common thing to have happen. Treatment-wise, the best thing to do is it takes time to recover. Oftentimes, going in and working with a physical therapist on a conservative basis is really the best way to approach this. The vast majority of people with back pain really improve within about a 6-week time frame or thereabouts. Conservative physical therapy is really the gold standard for treatment. It's cost effective. It's very effective.
And when you say physical therapy, what sort of things are being done? Exercising, is ultrasound, are there other things like that? Or is it all just doing certain exercise techniques?
Well, it's really kind of designed to the patient and what type of pain they're having. So some exercise programs can be more tailored to somebody that has like a disc type situation, which would be more of an extension-based type program of the spine. And other soft tissue issues can be addressed with other exercise means, and also like in manual type of treatments as well.
So, Dr. Jakovich, what about pain medication? Are there certain medicines that can help with back pain?
Well, absolutely. And this can be tailored again to the specific person. Depends on their symptoms. If we're having more radicular symptoms, medications such as gabapentin, Lyrica can be very helpful for nerve type pains. NSAIDs such as ibuprofen and these types of medications are also very helpful in the short term for alleviating some inflammation. Occasionally, prednisone can be a helpful adjunct for treatment. What you can also do as far as treatment of back pain, assuming we have a radiculopathy, you can use epidural steroid injection. That can be used selectively if a person has an obvious suspected, say, with radiculopathy of a certain nerve level. We could target with fluoroscopy and an injection toward the nerve juncture at the spine, kind of correlate, and we can put an injection into the spine, that area, in an epidural space, and that often can kind of settle down an acute radiculopathy.
What about muscle relaxers?
In the short term, these can be helpful as well, especially when people are experiencing muscle spasms, which often can happen in an acute phase. So in the short term, these can be excellently utilized for sure. It wouldn't necessarily be a mainstay of treatment, and as time goes on, we want to try and curtail and wean people off these types of medications. And other types of medications that we've used in the very, very short term and in extreme cases, narcotics can be very appropriate, although very selectively and only in a short period of time. It has been, studies have shown that long-term use of narcotics for back and neck pain is actually becomes counterproductive. So we try to curtail that as much as possible.
Well, let's talk about prevention. How do we prevent back pain?
Well, prevention is actually the key of all this. Stabilizing your spine, a good core spine strength is really key. So ultimately, the stronger your spine is and the muscles around it, basically, to stabilize your spine, the better off that we are, and the chance of having injury or pain is much less, for sure. I always think of your muscles in your spine as being like the guy wires of a tent. It gives us structure. If we can keep our body mechanics more optimal, such as lifting, pushing, things along those lines, not to strain our spine, that is probably the best way to prevent things with the stability of your spine with the muscular component.
And being active, I would assume, helps, right?
Oh, absolutely, absolutely. I always advocate a good back program, an exercise program. Often doesn't take more than maybe 10 minutes a day to really get kind of your stability going. An adjunct to that is a pool-based aquatic therapy program, which I think is a really good way to get your core stability in your spine, and just being active and walking, definitely.
And also watching your weight too, I would imagine, because your spine is holding the weight of your body. So
us Americans are, as time has been going on, we're becoming larger people, and the back injuries and back pain incidence, I believe, is probably increasing as well. So if we increase and improve, I should say, if we can improve our ideal body weight, it's having much less of a strain on our back and the rest of our joints as well.
Great. Well, unfortunately, we're all out of time, but I'd like to thank our guest today, Dr. John Jakovich, physical medicine and rehabilitation specialist from Mayo Health Systems, for joining us on this great topic. Thank you very much.
Well, thanks for having me.
Have a great day, everyone, and be healthy.